Well, last week I sat down with Dr. Caroline Wilson from Vance Thompson Vision to learn about their specialized care and culture of making every patient feel like they aren't just another number. Take a look. Thank you for joining us today, Dr. Wilson. Can you tell us about Vance Thompson Vision?
Yeah, thanks so much for having me. We are really excited to be here in Cedar Rapids. We've been around for a year. We celebrated our first one-year anniversary just this week.
Congratulations.
Thank you. Yes. Yeah, it's been fun. So Vance Thompson Vision was founded by Dr. Vance Thompson himself. He is a South Dakota native and started his practice there after some refractive training early in his career, and really started Vance Thompson Vision, the entity, in the early 2000s, and it started growing more in the 2010s. Started in Sioux Falls, South Dakota, but since then it has now grown to 9 sites across the Midwest and the Mountain West, and we opened our Cedar Rapids location last year. And our founder, Dr. Thompson himself, his motto is really, if your team and your people feel cared for and they care for each other, then the patients are going to feel cared for too.
Yes.
And so we are very people-centric. We want people to come in and feel like they're not just another number. We want them to feel cared for the way that we care for our staff.
Let's talk about the services you provide.
Yeah,
Vance Thompson Vision.
Yeah, absolutely. So we do anterior segment care, so surgery and medicine. So
surgery and medicine.
What that means is the anterior segment of your eyeball. So if it's at the front of the eye, then we generally will treat it. So we don't do retinal care. We don't do a lot of eye muscle surgeries, things like that. But we'll do cataract surgeries. That's bread and butter, I think, for a lot of us ophthalmologists. But we specialize specifically in refractive cataracts, and so our goal is to really match patient to outcome and give people the best experience they can have. We do a lot of refractive surgery, and by that we mean LASIK, PRK, ICLs, which are implantable contact lenses. That's what most people know.
Okay, I didn't know.
Yeah.
Implantable contact lenses. I didn't know that was a thing, honestly.
Yes. Yeah, it's actually growing in popularity. I think that LASIK has always been a fantastic procedure, but there's some advantages to doing implantable, we call them implantable contacts or implantable Collamer lenses. They're great for people who don't want to deal with some of the side effects of LASIK, like dry eye. And they treat a very wide range of vision too. So
how does that work? Like, because your vision does change over time. I know mine certainly has. So how does that work?
Our bodies and our eyes go through different stages at different points in our lives, and so we kind of group. You know, when we're kids, our eyes are changing, they're growing, and we settle into our prescriptions somewhere in our late teenage years or early 20s, generally, and that's where your prescription really starts to get set. You know. After that, so if you're doing refractive surgery early in life, things are going to stay pretty stable, but usually somewhere in our mid-40s, most of us, it happens to the best of us, we're going to start to need reading glasses. We start to lose our accommodation, and so reading glasses pop in, and then somewhere in our late 40s, 50s, we actually start to develop cataracts. Most of us need cataract surgery before
so that's common.
Yeah, super common. So that's the second time in life, that kind of like mid-40s to mid-50s, where you start to see your vision change again.
It has significantly changed, because now I need readers for everything. I don't need a prescription yet, but when do I kind of know if I need a prescription, or maybe I need to look into, you know, the contacts or
That's a great question.
The permanent contacts,
Yeah, I think a lot of people are surprised by that change in their mid-40s. So one, just recognizing that it's normal.
It feels like it was overnight.
And we hear that too. And it's gradual, but it can feel that way when you suddenly lose that ability to function the way that you used to. But when do you need to be checked, right? Or when do you need to have your eyes checked? Generally, once you feel like you can't find an over-the-counter reader that's working for you, or you just feel like you're distant and near, you can't find that crisp vision you're used to. We can really tailor what you need and where you want to see. Do you want to see here? Do you want to see here? You know, there is some precision that we can add when you see a specialist. And then, you know, glasses, contacts can work very well for a lot of people as their vision changes, but there are some surgical options, and everyone's a little different depending on your prescription, depending on the health of your eyes, and that's what I do.
Does it work right away, or is there a time, like what's the recovery time?
Again, everyone's a little different. Their health's different. The degree of intervention that they need is different. But generally speaking, cataract surgeries, our refractive surgeries, our LASIK, our ICLs, those are pretty quick turnarounds.
Oh, wonderful.
So vision-wise, people can see well within a week.
And that's a good turnaround.
Yeah. Oh, it's quick. There's still tissue healing, but it's pretty miraculous what we do. I love what we do. We also do a lot of glaucoma surgery and corneal surgery, so corneal transplants. So those are a little bit different. Those are longer healing.
Oh, I imagine.
But yeah, bread and butter. You can turn someone's vision around pretty quickly.
You have an event coming up, is that correct?
We do, yeah. So on December 4th, we are doing a blood drive with American Red Cross.
Okay.
And we're combining it a little bit with LASIK screenings. So if you are that person who isn't sure where your vision's at and you want a little bit more advice, come see us. When walk-ins are welcome. And we'll also have some holiday vendors there to, and a Botox booth. We have a nurse practitioner.
A little bit
so there you go.
there.
Yeah.
Okay. Where can people get more information on your website?
Yes, we have a website, VanceThompsonVision.com.
Okay.
We also have a Facebook site, but I think most of it would be on our main website.
Okay. Thank you so much, and I do need to get my vision checked. So.